I'm the owner of Authentic Insight Psychology, and I'm also a mom of two. I have a 5-year-old son and a 1-year-old daughter. And I'm so glad that you're here today. I'm really honored to be speaking about a topic that is very near and dear to my heart. And I'd like to take a moment to have us reflect on why we're here today. So, why are you personally here today? Maybe you're struggling with processing a traumatic birthing or perinatal experience. Maybe you went through something that was difficult, or maybe you've been explicitly told that what you've experienced is birth trauma. Maybe you're wondering if any of this applies to you and you're like, oh, I signed up for this. Is this going to be helpful? Is it going to be relevant to what I experienced during pregnancy and postpartum? And it's really common to doubt whether some of these terms apply to us, right? So sometimes we're doubting, was what I went through serious or bad enough, right? The word trauma has so many connotations to it. And it's really common and almost tempting to maybe dismiss what we went through as, oh, okay, that was just disappointing. It was frustrating, but that wasn't traumatic. And maybe that's the case. But sometimes we use those words, and if we learn about what trauma really is and how these experiences affect us, this may be more relevant than you think. So whether you identify with that word, whether you don't, whether you're on the fence, still figuring it out, I think that today's webinar can still be really helpful and valuable to you, or at least I hope so. What we'll be talking about today is going to delve into the spectrum of all of these experiences. And I want to start by talking about one of my favorite concepts in therapy, the concept of dialectics. Most often, I think about this in terms of dialectical behavior therapy, which is a therapeutic modality. But dialectics really means that two things that are seemingly opposite can be true at the same time. So love and hate, joy and sorrow. Both of those things can coexist, even though we think of them as opposites. And I found both through my personal and professional experience that there are very few situations that are more illuminating or really embody this idea of dialectics than parenthood and the birthing experience, right? There are so many contradictions, so many opposites that are true all at the same time during this one really momentous occasion in our lives. So, for example, the joy of holding your baby and the devastation sinking in that, you didn't get the birthing experience that you planned and hoped for such a long time. The exhaustion of sleep deprivation and the physical exertion, right, taking a toll on you, and also being so on edge and unable to relax because you're worried about what is going on with your baby or what's about to happen, right? You're exhausted and you're also on edge and can't relax. It can be exciting and also nerve-wracking. It can be beautiful and gruesome, right? All of these words can be used to describe some birthing experiences. And the list can go on and on, but I think that what I really want to draw attention to is that as a society, we tend to dismiss or minimize the negative parts of those contradictions, right? And we really, really focus and encourage parents to embrace and talk about the wonderful, happy, beautiful parts of it, which are, of course, important and also usually not the whole story. So when you think about or you share that you've given birth or that you've had a baby, everyone really wants to know, oh, it's so cute and it's so wonderful. And they want you to gush about all like how great it was. Um, and that misses a really big part of it because, at least for most people, it's not all so great, right? And for some of us, there was a lot that was not so great in addition to having this beautiful child. And so sometimes the pressure to put on this brave face and to focus on the positives can actually be really harmful to us and to the way that we go through postpartum and we process our birthing experiences, because then we are, sort of internalizing this pressure to dismiss the negative, push it aside, minimize it, say, oh, okay, maybe it wasn't that bad, right? Well, like it's okay. I'm happy, I'm healthy, I have my baby. So what if some of that bad stuff happened? That's behind me. And what we'll talk about today is that that's probably not the most helpful or healthiest way to move forward because processing, acknowledging, and really understanding how some of those negative, difficult experiences impact us is really, really important to being able to move forward. So let's talk about it. What is birth trauma? There are a couple of definitions that I'll give you, right? These are taken from academic papers. One is that birth trauma is an event occurring during the labor and delivery process that involves actual or threatened injury or death to the mother or her infant. The birthing woman experiences intense fear, helplessness, loss of control, and horror, right? So that is one definition. Another is that it's an experience of interactions or events related to childbirth that caused overwhelming or distressing emotions or reactions, leading to short or long-term negative impacts on health and well-being. So I think those are good definitions. And my favorite one is probably that birth trauma is actually experienced in the eye of the beholder, right? Birth trauma is so subjective and so personal. It's really hard to objectively say that was birth trauma and that was not when you're not the person going through it. So often we might rely on our healthcare providers or professionals in the field that we're entrusting our care to guide us and let us know, like, hey, am I okay? Is what I went through all right? Is that normal? Right. And really, they can comment on it. They can let us know what their experience and impressions are. But at the end of the day, it really comes down to that experience was like for you. What one experience was like for one person may impact another person incredibly differently. Right. And so I think first and foremost, acknowledging that no one else can really define whether something was traumatic for you is really, really important. I want to talk about birth trauma as something that is valid. I spoke earlier about our tendency to dismiss, and I think that that's true for some of our loved ones, people around us, whether it's our partners, our providers, our friends, to, with the best of intentions, kind of sweep the bad stuff under the rug and say, oh, but, it's okay now, right? And kind of fast forward or gloss over the parts that were traumatic. And I think it's really important that we acknowledge, like, hey, actually, no, that was traumatic for me. That wasn't something that I can just get past. Maybe I've tried. Maybe I've tried to just put it behind me, but it somehow keeps creeping back in. And so I want to normalize this a little bit by saying that this is something that's really, really common. So 1 in 3 birthing people perceive their childbirth to be traumatic, and 4 to 6% go on to develop PTSD or post-traumatic stress disorder. So birth trauma is real, and your healing that birth trauma really, really matters. It's crucial. It's important. And I want to give some examples of birth trauma. Again, just echoing what was said earlier, if any of this feels particularly triggering, if you're not in a space where you can talk about or hear about this, it's perfectly fine to opt out, to take a break, step away, mute this, skip this part of the recording altogether. That's totally fine. But these examples are taken from a 2004 paper about birth trauma. And these are some examples, but by no means are these all encompassing. It's not an exhaustive list, and these are things that may lead to birth trauma. Um, some of the examples on this slide start off with emergencies, right? So an emergency C-section, fetal distress, cardiac arrest. These are perhaps some of the more obvious examples of birth trauma. There may be some of the ones that we've seen on TV or when people talk about birth trauma, this is the first thing that they think of. But I want to really draw attention to some of the other examples that are on here, right? So things like separation from our infant while they're in the NICU, a prolonged labor, or a very intense rapid delivery. And then this last box on my slide, I think, can be expanded to so many slides because there's so many versions of this and stories that I've heard, again, both personally and professionally. bad experiences that were really, really harmful and really difficult and often traumatic, but that may be easier to sort of slip through the cracks when we're talking about birth trauma. So things like providers being dismissive of our birth preferences, of our identity, providers being not hearing and not listening to our pain, right? And not addressing it, inadequate care, right? Or inadequate monitoring. Um, there's so much to dive into here. And I think that what this demonstrates is that all of these examples are on a spectrum, and one of these is not worse or more serious than another when it comes to it being experienced as a traumatic or difficult event. Um, what we also know is that these events, right now, the ones on the slide talk about the birthing experience, but we know that it starts sometimes before you're in the hospital, right? This can start with your prenatal care, your interactions with your providers and your doctors and those around you while you're pregnant. And it can also span long past you delivering your child, right? So your immediate postpartum experiences and then experiences that are further, right? So postpartum complications, having to be rehospitalized, the conversations that you do or don't have with your providers and those around you after you've given birth, the transition to bringing an infant home and integrating this infant into your life, the support that you do or do not receive around it. This can all contribute to um, your experience of your childbirth, how you remember it, and then also your lasting mental health, right? It can contribute to things like anxiety, mood disorders, OCD, PTSD. These are all interconnected. And I think that, again, I could probably do an entire presentation on just that, but I want to make sure we also get to the parts where we talk about what is it that we do once we've experienced some of these events. Some symptoms and impact of having a traumatic birth, of birth trauma, are avoidance, right? So you may avoid situations, places, senses that are associated with what happened. So smells, specific people, specific colors, specific sounds, dissociation, right? So this idea of like I'm physically here, but mentally my mind is not here. I am in a distant place because I am either feeling like I'm once again unsafe in the present moment, or I am overwhelmed and can't deal with, I can't process what's happening right now, or I'm having a re-experiencing, a flashback to what happened unexpectedly. Hypervigilance, right, or hyperarousal, being on edge, being really, really cautious and really on high alert at all times, even though the physical danger, the danger that I've experienced has passed, right? I'm not in a situation that I am at risk of being harmed, and yet I feel like I am. So I'm looking out for all the warning signs. Experiencing anxiety, constant worry, and then ways to cope with that anxiety that are maybe not so helpful, constant checking, reassurance seeking, experiencing mood swings, irritability. It's tricky because some degree of mood swings comes with the hormonal shifts that happen after giving birth, but what we're talking about here are mood swings that last beyond that, right? Experiencing depression, again, beyond those couple of weeks of baby blues, which are expected. If it's lasting longer than that, it may be a sign of something more serious. And it's something that birth trauma can absolutely contribute to. Having intrusive thoughts, both about what happened, right? So, like I mentioned, flashbacks and a re-experiencing of the events that transpired, or intrusive thoughts about what may happen as a result. Having difficulty remembering. This is a really interesting one where so many people say like, oh, I can't stop thinking about it. I can't get those images or thoughts out of my head. On the flip side, one really common symptom of birth trauma is actually, I don't remember what happened. And that can, sort of cascade into a whole host of other issues of what do you mean I can't remember my child's birth? How could I possibly not? And it's a really, really common symptom. I'm going to talk in a minute about the function of some of these responses. Um, but guilt, shame, self-blame often come with the territory of experiencing birth trauma, as do sleep difficulties beyond what a newborn might cause, right? So sleep difficulties, I have the time to sleep, my partner or a family member it has, the baby, I'm okay, I can sleep and I can't fall asleep, or I'm constantly waking up, or I'm having nightmares. Changes in appetite, and I've already talked about, re-experiencing what happened. So when we talk about trauma, the reason that I'm talking about some of these common symptoms and the longer lasting impacts of birth trauma, it's really important to understand that one way to think about a trauma response is that it is a normal response to a very extreme situation, right? So some of the guilt, shame, and self-blame comes from what's wrong with me? Why am I reacting this way? This is ridiculous. What happened wasn't even that bad. And yet I am, months down the line still having these symptoms. What's wrong with me? Nothing is wrong with you. You have been through a really, really extreme situation, something that is out of your norm, something that you weren't expecting, something that was you were in a really vulnerable position, feeling like you or your baby were at risk of being harmed, something really seriously was going wrong. And so your brain jumps into, I must prevent this from happening again. It jumps into preservation mode. Its job is to keep you safe. And some of the ways that it does that is by let's avoid the things that are scary. That is one way to prevent it from happening again. Let's be on the lookout for any signs that that may happen again. Let's block it from our memory. Let's forget it, right? And these are obviously not conscious things that you're doing. No one's walking around saying, like, I'm going to do this on purpose, but your brain automatically does that. It's doing its job. And while in the moment, maybe some of these things may have been helpful, right now, once you are no longer in that birthing room, once you are no longer in that same situation, now some of these responses, some of these symptoms are what's getting in the way of you living your life and functioning day to day, right? That's why we want to process the trauma so that it becomes more of a memory. It becomes more integrated with everything else that you've lived through in your life, and it becomes less present in the moment. It becomes less interfering with what you're going through right now. Before we move on to how we can start to heal and process birth trauma, I want to talk about some really common myths and hopefully dispel some of these. So myth number one, I've already alluded to, healthy mom, healthy baby is enough, right? So if the birthing person is healthy and the baby is healthy, what's the problem? That should be enough. And like, no, it's wonderful. And I'm sure that we feel so much gratitude and relief if we are healthy. Um, that's not the only thing that matters, right? We can be grateful and relieved and happy that we are healthy and still feel anger, frustration, fear, disappointment, any of those and any of the other emotions in addition to that about what happened. I'm so happy that I am healthy, and I am absolutely crushed that my birthing experience was not what I hoped and planned for. Myth number two, you are to blame for what happened. Again, this can be a really common trauma response. It's my fault. I must have done something wrong. If only I had done something differently, this could have been prevented. That is, again, your brain trying to make sense of what happened. It's trying to rationalize something that doesn't make sense, something that was unexpected, that we were unprepared for. Most often that's inaccurate, right? Most often, at best, that's a part of the story, and sometimes it's not even a part of the story, right? And so we sometimes talk about the distinction between responsibility versus regret, right? Even if there is something specific that you're like, I wish I could go back and do that differently, fine. So you regret doing things a specific way. That doesn't mean that you solely hold the responsibility for the events that transpired, right? Sometimes that responsibility lands squarely on our providers or the people that we've entrusted our care with. Sometimes it's nobody's fault, but it's just something that happened that was really, really awful, right? So there's more to the story than just this automatic, oh, it must be my fault. Myth number three, only moms experience birth trauma, right? So I'm talking about birthing people, the birthing parent here a lot. But birth trauma can also very much be a thing for partners, for anyone that was in the room, for providers, right? We've talked, or I've talked a lot about vicarious trauma with people that I've worked with, right? So trauma that you experience by hearing about or seeing trauma where you're not the one experiencing it, but then as a result of hearing about it, you become traumatized. And so this is one reason I'll talk later about this in more detail, but it's one reason that it's not recommended that we just start talking about traumatic events or that we start listening to the traumatic events of others, um, because it can traumatize someone vicariously. We want to make sure we're doing it in a really safe way where the person hearing about the trauma is prepared for what they are getting into. I'll talk a little bit about this in future slides. Myth number four, birth trauma only happens after emergencies and is very rare, right? So we've already talked about this. It's not rare, 1 in 3. That's not rare at all. And it doesn't only happen after emergencies. It certainly can. But there are so many other factors that come into play and so many other instances that may result in a traumatic birth. Um, if it was really that bad, it would be really easy to tell, right? So this might relate to something that those around us, friends, family members say of like, oh, they seem to be doing fine, right? Oh, she's doing great. Um, Maybe on the outside, right? Maybe we are able to get through our day and we are able to take our other kids to school or we're able to go back to work. We are appearing okay on the outside, but on the inside, we're experiencing tremendous distress. Every moment, every day can be a struggle, right? Or something in between. And so it's not always visible. It's not always easy to tell if someone is really struggling. And so it's really, really important that if you are, that you reach out for help and that you communicate that to someone that you trust because it is really hard to tell sometimes. Um, okay. Myth number 6, now that you and baby are both home, it's not relevant or important anymore, which is similar to myth number 7, you should just get over it. There is no timeline for getting over it. And I don't know how one would just go about doing that, right? If we could snap our fingers and get over something traumatic, I'm sure almost all of us probably would, but it's not that easy. And there's no timeline. Sometimes we talk about birth trauma in the immediate postpartum period, but it can last months, years. If it's not processed, it can still very much be an impactful thing that can interfere with our quality of life. It's something that you carry with you. So no, there is no timeline, and I don't think that just getting over it is a thing. Okay, so how do we begin to heal? What is our path forward? This is a snapshot summary of some of the things that help with this. The first thing to note is that it's a slow process and it does take time, right? Just like there is no timeline for processing, for, getting over birth trauma, there's not really a timeline for healing either. Um, One part of the healing process is sharing your story on your own terms. And I say on your own terms because that is the key part of it. Yes, sharing, communicating is important, but if you're not doing it on terms that you feel safe and comfortable with, then it may actually have a reverse effect, right? It actually may exacerbate your symptoms. It may make things worse. And so I'll get into that in a little bit. But communicating and connecting with safe supporters in your life. Sometimes when we're experiencing really severe symptoms of a trauma response, our temptation, our urge is to isolate. And what I encourage you to do is to find supporters, find, even if it's just 1 or 2 people that you can connect with. Maybe it's a helping professional, counselor, therapist, or maybe it's someone that you see day to day, but someone that you can connect with and get support from. We'll also talk a little bit about mindfulness and connecting with the present moment. So much of trauma, depression, anxiety, so much of our struggles pull us to either stay focused on the past and what happened, or what may happen in the future and worrying about that. How's this going to impact my baby? How are things going to work out for me? Mindfulness encourages you to right now just be here, just be in the present moment. Um, all of those things may be true, right? The bad thing really did happen, and other bad things may happen in the future. But right now, today, here, hopefully you are feeling safe. Let us connect with that moment. Grounding and self-soothe strategies for difficult moments. I'll share some of those with you today. Setting and enforcing boundaries and practicing assertiveness. Again, I could probably give a whole talk about how important this is, but being able to communicate, this goes a lot with communicating with providers, right? So during postpartum visits, other medical providers, when you're receiving care, being really assertive and setting boundaries of like, hey, I'm not feeling safe right now. This needs to happen differently. I would really prefer a provider that has experience with XYZ. I would really prefer a provider that has experience working with the specific population who is trauma informed, right? Being able to ask for that and insist that that is something that's incorporated into your care, but also setting and enforcing boundaries with people in your life, right? So people who may urge you to share your birth story before you're ready, who may ask really personal details about what you've gone through or how you're parenting or what anything about your personal life. If you're not ready to share, it's okay to set boundaries and say, I'm actually not ready to share that. Thank you so much for asking. And I'll share that when I'm ready. Can be really helpful in establishing, again, some of those safe, healthy boundaries and a way to move forward without isolating, right? So in those situations, you're still connecting, you're still being surrounded by others around you, and you're not doing more than you feel safe doing. Cognitive restructuring and reframing. So this is part of processing your birth story, right? Is sometimes our thoughts are grounded in feeling, they are grounded in the emotion that we were experiencing during a really extreme, really scary time. And they are not always accurate, right? Our feelings, I say validate the feelings, but our thoughts we can examine and we can say, is this still true for me, right? What part of this is true? And am I seeing the full picture? We'll also talk about radical acceptance as a way to heal, and of course, seeking additional support. So when we talk about reclaiming our birth story, the first step to doing that, I would suggest, is writing it down, right? Again, you may have people in your life that will ask you about it. Please tell me about it. Let's talk. I'm here. I want to listen. And that is so great. And also, you may not be ready to do that. Journaling it, writing it down on your own, just for yourself, without any pressure to share, is a great first step because there's no one that you have to justify anything to. And I think it's great to have multiple versions of this, right? So first, it's just like, let me put pens to paper. Let me just like write something in my notes app about it. Let me write what I remember, right? Sometimes it might be bullet points, it might be snippets, it might be things that feel disjointed and like you can't make sense of it. Or maybe you've just been holding on to it, scared to let it out anywhere, and it'll come pouring out and it will be like an essay long. All of those are okay. But what I'm encouraging you to do, and what I'm saying you have permission to do, is to have multiple drafts of this. You can always go back and revise, right? Maybe one version is entirely focused on just one emotion that you were feeling. Maybe one version is just focused on one particular person that was there and that you interacted with, whether it was a negative or positive experience. But as you're writing over time, maybe you can consider incorporating different emotions. What thoughts was I experiencing? What were my five senses in that moment, right? Like, what were the smells? What were the sounds? And when you're writing, I would encourage you to use what, some people might call their best friend voice, right? So, how would you be describing a best friend's version of this story? How would you be talking about them? Would you be really harsh and critical? Would you be supportive and compassionate? Right? We are often so quick to criticize ourselves and to share kindness and understanding for others. I would encourage you to offer some of that to yourself as you're writing. And then when you are ready on your own terms, in your own time, you may consider sharing this story with someone. It may be a partner, right? A co-parent, it may be a friend, it may be your therapist. But doing so to somebody who you really believe will be able to lend a supportive listening ear and will listen non-judgmentally. Because again, sharing this with just anybody you run the risk of it having a reverse effect where it may exacerbate your symptoms. Somebody listens to your story and says, "Oh, it doesn't sound that bad. Oh, at least everything's okay now." Like that's going to probably cause you to shut down. It's probably going to cause even more guilt and shame of like, oh, they don't get it. Right. And yes, of course, you always run the risk of that, but you can communicate with that person ahead of time and say, hey, I want to share something really personal with you. Are, is it okay if I do that? Do you feel equipped to hear this right now? Right. Are you in a headspace where I can share some of this with you? Just please listen. um, that can go a really, really long way. And then in time, if you feel ready to do so, sharing it more broadly, right? Connecting with community in the sense of like support groups, right? So on a personal level, this is something that really helped me, which was attending postpartum support groups where it's not just parents who have given birth and have experienced something difficult or traumatic, but it's facilitated by someone who can help guide the conversation in a healthy and productive way. I think that's what was really key. You can also express yourself using art, music, creativity, right? So it doesn't just have to be writing. If you are somebody who is inclined to draw, to paint, to dance, to incorporate music into it, I think that can be really, really healing, connecting with other ways of self-expression and tying your birth story to that. And then meaning making can be a little bit tricky. Sometimes when people say like, "Oh, let's make some meaning of this," it comes from this like almost toxic positivity stance of like, "Let's find the silver lining, let's find the happy thing." And that's not at all what I mean when I say meaning making. I mean, what did this experience mean for you? In one way or another, it probably has transformed you or parts of you in some way. And so what was that? As a result, maybe it is something positive. Maybe you are stronger, but that's not necessarily the case, right? Maybe you are wanting to be more assertive as a result. Maybe you are more selective in the people you trust. What did this experience mean to you? Right? That's not something you're going to discover on day one, but it is something that may be important to reflect on as you are writing down and sharing your birth story. Um, there are a lot of strategies for coping with difficult moments. So difficult moments that may come up as a result of a trauma response, right? I'm having a flashback, I'm re-experiencing what happened, or difficult moments like, hey, somebody brought up birth or is talking about, their birth plan or is sharing their birth story. And this is kind of triggering for me, right? I'm feeling not great about this, or I get a call from that same doctor or that same provider that was in the room when this happened and I don't feel well. I feel like I'm in distress. I'm experiencing a whole host of symptoms. These can be helpful, and I view these as a toolbox, right? So we're not using all of these all of the time. We're pulling for what's helpful and what may get us through. And if one doesn't work, guess what? We have this toolbox filled with others that we can pull from. And so first is being aware and labeling like, hey, I think this is a trauma response. I think that what this is related to the trauma that I experienced, labeling triggers, identifying thoughts, feelings, reactions, and behaviors that for you are associated with that. It's going to be unique to everybody. I get a lot of eye rolls when I bring this up to new parents, but I cannot underscore the importance of like paying attention to your own health. So your own physiological needs, sleep, exercise, nutrition. I know sleep is probably impossible to come by for many of us with young children, but when you can, prioritizing it, moving your body, right? This doesn't mean you have to join an exercise class and work out X amount of times a week, but moving your body, having balanced nutrition, whatever that means for you, nourishing your body is really, really important because when those things are off kilter, we are more vulnerable to negative emotions. We're more vulnerable to experiencing all of the symptoms that come along with a difficult or traumatic birth, right? So, yeah, my mood swings are going to be more intense. I am going to be more emotionally dysregulated if I haven't had anything to eat today, or if I'm running on an hour of sleep as of last night. Mindfulness and grounding, I've talked about a little bit, right? Connecting with the present moment. One way to do that is through diaphragmatic breathing or deep breathing. I'm going to do a brief exercise in just a minute here to regulate our breath. Often, when we are in fight, flight, freeze mode, right? Our brain and our bodies are figuring out what do we do to keep ourselves safe? Something feels dangerous, our breathing changes, right? When we're feeling anxious or uneasy, start breathing really, really rapidly. And diaphragmatic breathing helps to even that out, helps us to pace our breathing so that it sends a message to our brains and the rest of our bodies of, oh, okay, if I am breathing in a more steady, slow way, perhaps I am not actually in physical danger right this moment. Progressive muscle relaxation, I don't know if we'll have time to do a full exercise through, but in general, it's an exercise where you go through head to toe different muscle groups and practice tensing and releasing them in order to release tension. So it serves as both a body scan of, hey, how are the different parts of my body feeling right now? And can I intentionally focus on relaxing them? Right. So if I said to you all, relax your shoulders, right? Okay, yeah, my shoulders are kind of relaxed. That doesn't do a whole lot probably. But if I said, okay, tense up your shoulders, bring them up to your neck like this and hold, 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 and then relax, release, right? That's a bigger range of motion. I can really tell the difference between my shoulders being so, so tense and now being relaxed. Now picture doing this for all of the different parts of your body, your face, your shoulders, your arms, your belly, your back, your legs. It's incredibly effective. It's very calming. Sometimes I recommend that people do this as a sleep aid to help them relax before bed. I will give a caveat that anything that involves you doing a body scan or paying attention to your body can, for some people, be triggering if they experience trauma that had to do with their physical body. And so keep that in mind. Make sure that if you're feeling uncomfortable, if this isn't something that's sitting well with you, take that out of your toolbox, at least temporarily, and use one of the other strategies. Social support and being really creative with where you're seeking it, right? So maybe you have, a proverbial village around you. Maybe you have family members, a partner, friends who are ready, willing, and able to lend you support. That's wonderful. If you don't, and you're feeling like, hey, I actually feel kind of on my own with this, what do I do? You can create your village, right? You can reach out to support groups. You can reach out to providers. There are people that are looking to connect. You can reach out, there's other parents that are probably going through something similar and would like to connect. And so I can't, again, recommend support groups enough for helping to heal your birth trauma. But sometimes those support groups are not enough, and you may need to seek other professional help, like a therapist, like a psychiatrist. So therapy and medication management are definitely important parts of this. Um, Checking the facts and affirmations. I don't think I have the time to delve into today, unfortunately, but checking the facts is a skill that comes from both DBT and CBT, and it can be helpful when you are writing your birth story to kind of do an audit of like, is this true? Right? And just checking it. Maybe it is, and great, and then we move on, but maybe it's not the full story, right? Like, so one example of this might be, I always do this, right? And using a phrase like always. Yeah, sure, that seems accurate. But if you really reflect on it, is that true? Do you ever always do something? That's a really, really extreme word. Can we reframe it? Can we say, a lot of the times I do this, right? Or sometimes I do this to more accurately reflect the frequency. That completely changes the tone and humanizes you in a big way, right? If you're not always doing something, but sometimes you are, there's more room for nuance, for living in that gray area, and room for all of those dialectics to exist. The reason that that's healing and can be really helpful when you're writing your birth story is because, again, it leaves room for you to incorporate a lot of those dialectics together. Whereas if you're writing just from an emotional standpoint and you feel really like locked into a narrative that is based in emotion alone without checking any of the facts of, is this really true for me? You run the risk of repeating and believing a narrative that doesn't serve you, right? So telling yourself, I always do XYZ, and it's something negative, is going to reinforce some of those feelings of guilt and shame. Whereas if you say, well, sometimes I do this, but other times I do XYZ, and it's a little bit more helpful, balancing that, if that's true, if that's accurate, opens up room for you to say, maybe then I can explore how this wasn't all my fault. Maybe I can think about what else was at play. What is the bigger picture here? Affirmations and mantras can be helpful. It's not everybody's thing, but reminding yourself, I am capable, I am strong, I have been through a lot, and I can handle whatever comes my way, right? You don't want affirmations to be something that are so opposite to what you're feeling right now that it feels like you're, for lack of a better word, gaslighting yourself. That's not at all what it's about. But if it's in line with your values and it's in line with what feels true for you or is aspirational, this is the kind of person I would like to be. And I believe this is somebody I can grow to be. Affirmations can be really helpful, and mantras especially can be really helpful. So a phrase or a quick saying that you can put on your phone lock screen that you can repeat to yourself when things feel really, really hard. Maybe it's going to be something really broad, like, oh, this too shall pass, right? Nothing lasts forever. Or maybe it's, even when things feel hard, I'm a good parent, I'm a strong person. Um, this is something that working with a therapist or a counselor can really be helpful because you can tailor these to you and what would be most helpful for your experience. So we talked about progressive muscle relaxation. I have different scripts that I use for this. And so if anyone watches this or is attending the webinar and says, hey, I would love to learn more about this, please reach out. I'm happy to send some of those materials your way. No problem at all. So diaphragmatic breathing, one way to do this is through box breathing. There's a million different strategies for how to incorporate breath work and breathing, but box breathing is really simple and really easy to remember. So you picture a box and you start here and you breathe in for 4, and then you hold for 4 without exhaling, and then you breathe out for 4, and then you hold for 4 before you breathe in again. And so you do this a number of times, I would say for at least a minute or two, right? And doing that slowly to, again, slow down your breath, make it more regular, and start to send the messages to your brain and your body of, okay, I am safe now. I talked about grounding as a way to practice mindfulness and to get yourself back into the present moment. This is also a way to connect with the present moment, to connect with your surroundings when you are being pulled to remember or re-experience what happened in the past or to worry about what's happening in the future. Right now, pick 5 things that you can see. I can see my computer screen, my keyboard, my pen, my paper, my calendar, right? So 5 things that you can see, 4 things that you can touch. I can touch the wire of my headphones. I can touch and feel the texture of my shirt, etc., etc. 3 things that you can hear, the sound of my voice, my fan, the traffic outside. 2 things that I can smell, my lotion, a candle that was burning earlier. 1 thing that I can taste, my mouth, right? It doesn't have to be any specific taste. But doing that, it's really, really, really hard for you to focus on things that either happened in the past or are going to happen in the future. They're very much encouraging you to say, hey, what's happening for me right now? This is one of my favorite skills for a number of reasons, and it can be really, really helpful to use this when you're going through a tough moment. Circles of control. So this ties into this concept of radical acceptance. And so basically you can picture 2 circles, a larger one of what I can't control and a smaller one of what I can control. I would love, I don't think we have the time today, but I would love to encourage you to do this on your own, right? Write out all of the things that you feel like you cannot control, that you don't have control over. And then what are some of the things that you do? And for the sake of example, some of the things that I can't control are the past, right? I can't build a time machine. I have no way to change that. I can't control global events or the news. I can't control the words, the actions, the feelings, the judgments, and beliefs of other people. It is just not within my power. Try as I might, I will never change other people's behaviors or feelings. I can influence them, perhaps, right? But I cannot change them. That's not under my control, just like the weather. I can't change it. What I can control, however, are my actions, my goals, my values, the way that I react to others, the boundaries that I set, right? The actions that I take to prepare for the weather, whether I bring an umbrella with me or snow boots or not. Um, Being able to distinguish what is under your control and what's not can help with the healing process because I encourage you to then focus on the things that are under your control, right? We're not saying forget or dismiss what you can't control, but sitting in that and lingering and ruminating about that is going to keep you stuck in the negative, right? It's going to keep you stuck in this feeling of like helplessness because you are thinking about the things that you have no control over. Whereas if you focus on what you can control, then you can take action, right? Okay, I can't control my partner's words. I can't control how they reacted, and that's really upsetting to me, and I wish I could. That's valid. However, what I can control is how I react to that, right? Do I communicate with them? Do I share that I'm feeling really frustrated and upset with them? Do I not? And do I go and journal or find a different support person to speak to about this? Um, do I set a boundary around how our communication has to go in order for me to feel safe in a conversation, right? There's so many things that you can do with that that are under your control, but that first means letting go of this desire and this almost need that some people think they have to control others, right? And this is where we get to radical acceptance. I know we're running short on time, but I have a few more slides. I'm hoping that we can get through them. Radical acceptance rests on letting
Olga,
go. Yes,
you're doing great. Just
thank you.
rather you get through them and let people take this at their own time than rush through it.
Awesome.
We've got to 1:15 is when we are slated to go, and I don't see
Excellent.
so just do a box breath.
Thank you. That's
Okay.
awesome. So the circles of control get us to radical acceptance. And radical acceptance is again, a skill from dialectical behavior therapy. This is a quote from Marshall Linehan, the creator of that therapeutic modality. Radical acceptance rests on letting go of the illusion of control and a willingness to notice and accept things as they are right now without judging, right? So it's really leaning into um essentially this state of mind, which is like it is what it is, right? I cannot change what happened. I can struggle, right, which will only increase my suffering. If I am determined to change the things that I can't, I'm kind of tying myself into the struggle of I'm going to keep suffering because it's not a winnable fight, right? I'm never going to be able to change the things that I can't. But if I accept that and I say, okay, I hate this, I'm never going to be happy or even okay with the fact that I can't control it, but I can accept that that is my reality. That's what is happening. And these are the things that I have control over. That may bring me more peace. That may make me feel empowered because look at all the things that I do have control over. Is this a perfect fix? No. Is this a cure-all? Absolutely not. But it is a really helpful mindset to have um, because so much of birth trauma relates to things that we had no control over, right? And things that we really wish were in our control, and it's not there. And this is why I say all of the feelings around it are so valid, but we can get eventually over time get to a headspace where we are accepting this is our reality, this is what happened, what can I still control and do moving forward. This is a series of questions that you can use again when you're journaling, when you are writing out your birth story, to help practice radical acceptance. So you start off with what's bothering you, right? What feels wrong, what feels distressing. How did your behavior contribute? Did it contribute, right? Do you feel like you played any part in it? Maybe not, maybe yes. But then also we're balancing that with how did those around you contribute to the situation, right? Other people in the room, your family, your partner, your providers, did they contribute? Maybe not, maybe yes. What did you have control over and what didn't you have control over, right? Going back to those circles of control, really piecing it together. What was out of my control? What did I have control over? Is there a bigger context, any past events that happened that led up to this situation, right? Birth does not happen in a vacuum. It's not something that is an isolated incident. There's always more to the story. There's always more that has happened. Did any of that contribute to how I experienced that situation, right? Whether it's a dynamic within a relationship, whether it's previous interactions with a provider, helping you to make sense and contextualize it. Okay, this is what led up to it. Again, what did I have control over? What did I not have control over? Who else contributed to it? And then practice radically accepting your feelings, thoughts, behaviors, what you can't control. Remember to try to avoid judgment, and that acceptance does not equal approval. So this is a really important distinction. Sometimes when we say, oh, I accept this, it sounds or you believe that it means I agree with it. I'm good with it. Yay. That's not the case at all, right? So acceptance just means I understand that this is my reality. I don't necessarily approve of that, right? In fact, in the case of birth trauma, I probably don't. I probably don't approve. I'm probably never going to land in a place where I'm feeling happy or positive, right? Some people might, but others won't. And that's okay. What we're doing by accepting is just saying, I understand that this is my reality and this is what happened. And then I can use breathing, I can use other strategies and figure out what do I do to move forward, right? Imagine how you change your behaviors by accepting this reality. So if I stopped struggling against the things that I can't control and accepted it, what would look different for my life? It's a really important prompt to reflect on and can be a helpful piece to incorporate into your journaling, your writing your birth story. Again, if it's something that you feel like you need more help with, this is something that a therapist or a counselor can really assist you with, because it may not be so easy to do this on your own, but you can give it a shot and see what comes up when you're ready. Okay, so what to do if you need more help? We talked about support groups, and I always give the caveat with trained facilitators, right? This unfortunately is not an instance where a DIY thing is okay, right? Like, so communicating with your friends about it, if it's a conversation that you've had, if they're prepared, if they're in agreement with hearing about your birth story and vice versa, fine. But I really caution people away from just sort of sharing it with anyone without doing that prep work ahead of time, because you really run the risk of potentially re-traumatizing yourself or someone else. You want there to ideally be somebody who is trained in these topics to be able to help facilitate and move the conversation in a direction that is helpful versus harmful. When or if you look for a therapist or a counselor to work with you on processing your birthing experiences, on support postpartum, ideally you'd be looking for somebody who has these letters after their name: PMHC, perinatal mental health certified provider. Um, are these letters absolutely necessary? No, but you do want to ask your potential providers, hey, what is your experience and training like in working with the perinatal population? Right? Because sometimes what happens is, oh, well, I'm qualified and trained to treat depression or anxiety or even trauma. Wonderful. That doesn't automatically translate to, I know how to do this with birthing people, with people who have experienced pregnancy, birth trauma, postpartum, right? It's not an automatic assumption that this is something they're qualified to do. So ask, be assertive, advocate for yourself, and really make sure that the person that you are entrusting with your care is qualified and able to carry that with you and help you during this really important process. There are different kinds of therapeutic modalities that you might want to look out for when you're considering therapy. So a couple of these are specific to trauma and a couple are not. So for overall support with mental health concerns postpartum, I recommend CBT, cognitive behavioral therapy, and acceptance and commitment therapy, or ACT. Both of these focus on processing and reframing thoughts. So CBT focuses on taking your thoughts, your understanding, your experience of a situation, and supplementing it, reframing it with thoughts that are more helpful. Because in CBT, we believe that thoughts, feelings, and behaviors are all interconnected. And so by working on the thoughts that you are having, replacing them with more helpful, more accurate ones, and incorporating that as part of your experience, that you can then shift your emotional experience and also the behaviors that are associated with it. Acceptance and commitment therapy, or ACT, is a third wave behavioral approach. So it incorporates what I mentioned about CBT, but also things like mindfulness, something called cognitive diffusion, where we we don't identify as our feelings. We put some distance between them. So, for example, I am not anxious. I am having the feeling of anxiety. I'm experiencing the thought that I'm anxious about this moment, right? Which sounds like it's a pretty minuscule nuance, but actually is really, really meaningful. ACT can be really helpful in terms of living a life that is grounded in your values and really, as it says in the name, focusing on that acceptance of, hey, maybe some pain in life is inevitable. However, I'm committed to living a life that's in line with my values. How can I do that? How can I take action steps towards doing that? Now, when we're talking about trauma therapy, in particular processing trauma, there are two modalities that I would recommend. One is EMDR, eye movement desensitization and reprocessing therapy. EMDR uses bilateral stimulation. So often it's moving your eyes side to side, but there are also things like bilateral tapping, basically things that focus on both sides of your body, stimulating both of those sides of your body while you're processing or thinking about or talking through a traumatic event, a really painful memory, in order to process it and integrate it with um, your overall experience, with your overall memory, so that it becomes more of a memory rather than this traumatic event that is shaping the way that you're going about living your daily life. CPT, or cognitive processing therapy, is similar to CBT in that it focuses a lot on our cognitions, on our thoughts. It's a relatively short-term therapy. It's evidence-based. It's really effective. It does not share the bilateral stimulation component, but it does something similar in focusing on stuck points or themes that come up that are perhaps either inaccurate or unhelpful in your narrative of a traumatic event. And so you reprocess it, you reframe the thoughts that you're having while also working on coping skills that help with things like mood, emotions, and being able to get to a place where, again, the traumatic event is not dictating how you're leading your everyday life. Um, Additionally, if you're feeling like you need help beyond this, right? More help if you're feeling unsafe, you're feeling like you're in imminent danger, maybe you're reaching out for support, but it's not readily available. If you're ever feeling unsafe or you're having a crisis, please call 988 and reach out for emergency help. 988 can help over text, over call. Um, don't hesitate to do this. Again, we're often really quick to dismiss our experiences, but a mental health crisis is an emergency, just like any other physical emergency would be. For additional resources, this slide has a couple of things, right? So Postpartum Support International is an incredible resource. They have so many things. One of the things that I would direct you to is the therapist directory. It has a list of people who are PMHCs, people who are trained in working with the perinatal population. So think therapists, psychiatrists, nurse practitioners. Um, there are also a couple of great organizations like the Motherhood Center and the Nesting Place that you can visit to find support groups, to find resources where you can safely share your story. And yes, thank you. We will send out the slides with all of these resources. Wonderful. You'll have access to this well beyond. Um, okay. I'm hoping we can take a couple of minutes and do this because this is one of my favorite mindfulness exercises from DBT. It's the loving kindness mindfulness meditation. And so I encourage you to follow along with me. Take this moment for yourself. We've just covered a lot of really heavy, really intense topics. But I want to end with this. Close your eyes if you feel comfortable doing so, or have a restful, easy gaze. Sit comfortably with your feet flat on the floor and your spine straight. Relax your whole body. Keep your eyes closed throughout the whole visualization if you feel comfortable doing so, and bring your awareness inward without straining or concentrating. Just relax and gently follow these instructions. Take a deep breath in, breathe out. Once again, deep breath in and a deep breath out. When you feel comfortable resting with the flow of your breathing, picture someone in your life who loves you or who loved you unconditionally. Evoking and giving yourself over to feeling the qualities of the selfless love and kindness they grant you or granted you, and the whole aura or field of their love for you, right here, right now, breathing with these feelings, bathing in them, resting in the warmth and radiance of their heartfelt embracing of you just as you are. Or drinking in the experience that you are unequivocally and unconditionally loved and accepted as you are, without having to be different, without having to be worthy of their love, without having to be particularly deserving. Take another deep breath in and breathe out. And when you feel ready, you can open your eyes, bring your attention back. I hope this was helpful. If you need more support, if you have questions after this presentation, definitely reach out. My contact information is here. And thank you all for joining me. I'm gonna hopefully get through some Q&A now. I'm gonna turn this back over to Susan.
Okay. I am going to remove the spotlight. Here I am. And that was wonderful. Thank you very much. Can we just do
Thank you.
that last exercise for about 3 hours? That would be great.
Amazing. That would be great.
I just wanted to put a plug, and we have a question here about EMDR. I did EMDR and finally cleared out some long-standing issues. It doesn't work for everybody, but it really was dramatically. I think it worked really well for me because my right brain and left brain, my left brain is just like, you don't, let's just rationalize that feeling. It's okay that happened. And the thing that I loved about EMDR was that it took that part away and just let me feel those feelings that I had squashed down so much.
Yeah.
So, question is, I have a therapist out of state, but I'm interested in EMDR. How do you find someone that offers this? Is the question.
That's a great question. So EMDR is a specialized training. Not every therapist is going to offer it. I believe that the organization that does all the trainings is EMDRIA. I can look into the exact link to that later, but they would probably have information about that. But also, if you go on Psychology Today, that's a directory for therapists in general, you can filter by modality, and EMDR should be one of those. So you want to look for somebody that says, I am trained in, or I hopefully certified in EMDR.
There is a woman, her name is Marie McDermott, and I don't even know if she's still practicing, but she was amazing. Um, and so I'll put her information in toward the end.
Right.
Um, so no other questions. We have a few more minutes if people want to pop in a question, but if people could put in the Q&A for us, and we'll also ask this afterwards, but just what are you walking away with here? If there's one thing, one feeling, what is it? And you can, like I said, just put it in as a Q&A question, but it's really just a comment. If there's something that you're walking away with from Dr. Fuller's talk, what would that be? And we'll give you a minute or so to put that in. or if you're just still processing it all. And then I have a question for you.
Sure.
Okay, I'm going to ask my question and maybe we'll
Okay.
get. And one of my questions is this idea of self-care. There's so much, you just need to take a hot bath, take a hot shower, do this and this and this. And so for people, and then you said earlier about like what I've been seeing is a lot of toxic positivity. Um, how do you know if you need to take a hot bath or more? And you covered a lot of that in the some of the things, but do you feel like along with this toxic positivity that the healthcare, kind of the self-care and um, that can also be more detrimental in some ways? And if so, how?
Totally. So the term self-care actually comes from trauma work. And people have sort of taken it and run with it and saying, like, yes, everybody needs self-care. And of course, this is true. But again, we sort of have taken this term and turned it into exactly what you're saying. Bubble bath, spa day, treat yourself, right? And sometimes that is exactly what you need and want, and that can be helpful. But sometimes when we have social media and friends and family and loved ones and everybody telling us that that's something that we need to be doing, that actually turns into one more thing that we are feeling pressured about. That's one more thing that we're potentially failing at, right? Oh, I didn't take a bubble bath again this week. I guess I'm not even good at self-care, right? And that can be so harmful when you're already struggling with so much after having a difficult birth experience and like dealing with the postpartum fog of having a baby. Like there's so much there. So self-care can be something really, really broad. And it can be as simple as taking literally 2 seconds and checking in with yourself and asking yourself the question, what do I need right now? Right? And the answer might be sleep. The answer might be help. The answer might be a break, right? And maybe you don't have the luxury of even a 10-minute break, but can you take one and do a loving kindness mindfulness with yourself? Can you do a box breathing set, of a minute or two as you are, coming out of the bathroom, as you are getting ready for bed, right? Figuring out moments of time where you can do that, where it's not time consuming. It's not this extra chore that you're adding to your to-do list. And instead, it's something that you are addressing your needs here and now. Obviously, a spa day would be great if that's what you're craving, but sometimes that's not what you're craving, A, and sometimes it's just not possible. And then you're left feeling even worse about it. So, what's feasible right now? How can we do it in tiny increments? And how does it really address the needs that we have right then and there? That's self-care.
Yeah, I think that's a really, really important point. Um, so we're gonna wrap this up. We will send the slides out. I will send the name of the person after I find out if she's retired yet.
Okay, great.
You are available for Zoom webinars, or excuse me, Zoom therapy.
I am.
You also will have a 1 day in person. It's going to be out on Long Island. So if you and do you allow babies to come to that? That's what I do.
Absolutely.
Okay.
Yes.
So
Yes.
if you are in the still having a baby stage and have a car, you can drive out. And what day of the week is that going to be in 2026?
TBD, but likely Thursdays.
Okay. Okay. Um, for those of you or those of us who have had a traumatic birth experience, I send you lots of love and compassion. I was telling Olga before we started, I had a baby 24 years ago and it's still there. So I think I need to come back to you, Dr. Fuller. But this is hard stuff.
It
This is
is.
very hard stuff. And we do try to say to people expecting. It's not a birth plan, it's a wish list. So if you reframe those expectations as to that baby may have its own mind, and it may not go as it was planned. And that was a hard thing for me to do, to say, uh, to give myself permission to be disappointed.
Yeah.
I think that's an awful lot of it. So thank you so much. One last statement from you about dealing with all of this.
Thank you so much for having me. I think this is such an important conversation to be had, and I hope it doesn't stop at this webinar, but really just there's no timeline. There's not any checkbox or bar that you have to reach in order for this to be relevant to you. Your experience matters, and so does your healing. And so hopefully this inspires you to take the first step or the next step in your healing journey.
Thank you so much.
Thank you. Take care.